Welcome everybody to our AI Ascend series. Today I have with us Dr. Samira Ebrahimi Kahou. I hope I said that right. Samira is the assistant professor at the University of Alberta and adjunct professor at McGill and ETS, and also is the Canada CFAR AI Chair in at MILA. And she works on clinical decision support systems. It's quite the long title there, Samira. Really happy to have a chat with you this morning. Just to kind of start off, can you just tell me just a little bit about, what inspired you to focus on healthcare and, bias modulation and machine learning, and how you're applying that to your healthcare research right now?
Thanks a lot, Mark, for inviting me. I would say we all know that AI became pretty successful in different domains, and currently there are a lot of applications that are used mostly in high stake. I personally picked health because that helps more accessibility, so that especially during some situations like COVID, that we need more kind of support, we can use AI as an assistant for decision making. In terms of modulation, like tackling bias in generally, that's a very important topic for AI to make sure that at least we're aware of bias, whether we can completely mitigate bias or not, but it's important to have that or have explainability that explains these kind of issues when clinician makes decision based on AI. That's why I'm focusing on bias mitigation. In the recent work that we discussed bias, basically I see it differently in healthcare, because in healthcare we need the bias, but we need to use it properly, because a lot of disease that we know somewhat relates to your genes, to race. So that's why we presented a work on bias modulation. And that's where we predict this, in that work we predict this kind of information, but we modulate a general network to be personalized per individual based on their race, age, etc., which has an impact on diagnosis.
Wow. Yeah, I had a chance to review your paper, and you propose a novel two-step approach to personalization without harm in machine learning. And I think that's very interesting. Can you just kind of walk us through those key insights that led to the development of this approach and how it addresses limitations of traditional personalization methods? How did you kind of drive towards that process?
So the work we did, it's just a initial step towards building something general. But we were inspired by another work where the message of the other work was that if we build different models per race or gender, we will get an overall better accuracy, because we will have several personalized models. In that paper, we're saying we can have two-step kind of modulation where your first network predicts your sensitive attributes, and that's usually exists in healthcare. So you can say in privacy kind of applications you do not have them, but in healthcare domain you usually have them. And the first network can give you the bias modulation for your second network. So the first network already knows, let's say, your gender, your age, and then that would predict the proper bias for your second network. So this way we will have like one model that can be trained end to end and kind of scales better.
That's extremely interesting. I know you and I've talked in the past just about, the GPUs that you have to do to run this stuff. So I know that your research involves training these complex machine learning models. Can you just talk about the experience working with your research team of what that means, and how do you guys use the NVIDIA platform to help support this last project that you just published here this month?
Yeah, so GPU is basically essential to our research because the more AI advances, the more these models become like bigger. We will have more data available then, and of course there's currently a lot of foundation models that are that requires a lot of resources. So especially for that work, we used because we wanted to train on several data sets and see what we are proposing actually is helpful, like generalized as well across different kind of tasks in diagnosis. So we used the resources that from you basically, and it was very helpful to use H100 because the training is way faster and bigger data. So that's that I would say is very, very essential these days.
Where do you see your research heading, Samira?
So we're currently thinking about we're moving towards having foundation models. Again, this work that we're talking can be used because it can modulate, the first network can modulate any second network. It can be a foundation model, it can be any big model here. So we're currently working, one of my focuses again, on the machine learning side, I focus on bias mitigation and explainability. But on the health, we are currently focusing on computational pathology and building one big network for foundation model for multitask diagnosis of brain images. So that would require, of course, a lot of resources to train, and we're already trying, and that leads to millions patches of data we're currently optimizing to see whether we can train one foundation model specific to brain images. So obviously, the resources would never we always need more as the more data becomes available. So
I think that's very exciting. As you and I have talked in the past, I'm super passionate about how AI can impact healthcare and see it as a prime use case, and it's through the research of people like yourself and the support of the University of Calgary and CFAR and try to develop this, and so I can't wait to chat with you maybe in a year to talk more about where this project has taken you. And I want to thank you for spending some time with us to talk about our AI Ascend program, which is really about enabling AI researchers and AI driven businesses and how we can help AI move society forward. So thank you very much, Samira, and I hope you have a great day.
Yeah, thank you so much.